Expert virologists and doctors have theorized the possibility of a third wave. Is this something that India should be concerned about? Quite possibly, and here's why. There has been a surge in the number of Covid-19 cases since the month of March 2021, with a peak of almost 400,000 cases per day in the month of May. And although experts believe that a steep fall in the number of cases is likely to occur until 1st July, this is exactly where things get worse. Every 3 to 4 months, there seems to be a surge in the number of cases, with the most recent being in the months of April and May. With this trend in mind, it's safe to say that the commencement of a third surge is likely to occur in the month of July, with the peak number of cases being in the month of October. There are many reasons why the third wave may occur, but the most primary one is that new mutant, highly transmissible strains are always on the rise. These so-called super spreaders are easily transmitted from one person to another, and this is what leads to a surge in the number of cases every few months. Initially in India, the B117 strain in Delhi and Punjab and the B1618 strain in West Bengal were the major causes for a surge in number of cases in India. But the most recent surge in number of cases is due to the double mutant strain B1617. It is of two variants, the B16171, which was first seen in India December 2020 and was initially quite rare, but the most prevalent of all, the B16172, which is now seen worldwide, particularly in India, and a sudden surge in the number of cases since April has been seen due to this variant. The sudden surge in cases since April indicates that the B16172 variant is much more transmissible than the previous ones. And this is likely due to its adaptive ability caused by mutations in its spike protein, which is responsible for its virulent activities. When a virus enters our body, it binds to our host cells using its outer spike proteins. These spike proteins bind to receptors in our body, such as our angiotensin converting enzyme 2 receptors. The virus then expels its viral RNA content into the host cell cytoplasm, where this viral RNA then utilizes our host cell mechanisms, such as our ribosomes. These SARS-CoV-2 strains continue to go through multiple mutations in order to produce a variant capable of increased transmissibility and overall better virulency. This B1672 strain is also known as the double mutant strain because it has gone through two mutations in the gene encoding the spike protein. Mutations in the receptor binding domain and mutations in the furin cleavage site has led this strain to cause increased ACE2 receptor binding and therefore better transmissibility, while also decreasing the binding to monoclonal antibodies and therefore reducing its neutralization potential by these antibodies. The third wave poses a much greater threat than the previous two waves. This is because the virus will mainly target children. Children will be the most affected since they have not been vaccinated due to unavailability of vaccines to younger children below the age of 18. And as clinical trials continue until 2022, vaccines for children will be made available after 1 whole year. Also, most children have not yet been exposed to the virus, so the virus will target them as they have greater affinity towards those without immunity against it. Additionally, children generally have weaker immunity than adults, which makes them viable targets for the next wave. Those who are immunocompromised are at much greater risk for infection, especially the growing number of diabetic children in India. Data from the first wave showed that in the first wave, 4% of children were affected, while in the second wave, 10 to 15% of children were affected. Following this pattern, the third wave could affect more children than the previous two waves combined. And the signs are showing. In just the 5 worst affected states, Karnataka, Maharashtra, Chhattisgarh, New Delhi, and Uttar Pradesh, almost a total of 80,000 children were affected between the months of March and April. And due to the surge in double mutant strain infections, an increased number of symptomatic cases were being seen in children less than 16 years of age. This comes to show that the new strains have improved in their virulence, and therefore the third wave poses a much greater threat to the children. Infections to children not only affects them but their families too. Children can act as super spreaders and spread to their family members, owing to an accelerated surge in total cases in the third wave. Symptoms during the third wave will be quite similar to the previous waves, with the common fever, productive cough, and shortness of breath, along with the occasional upper respiratory tract infections. However, a complication to be concerned about is the multi-system inflammatory syndrome in children. And although it is currently rare due to its requirement for genetic predisposition, it is bound to be a common complication in children in the third wave. This disorder is caused by a mass release of cytokines from various cells in our body, including the neutrophils, the monocytes, the platelets and endothelial cells due to tissue damage, and also activation of T cells and or B cells, leading to a cytokine storm. The cytokine storm induces severe inflammation, which then causes fever and skin manifestations, neurological manifestations, gastrointestinal manifestations, respiratory manifestations, and cardiovascular manifestations. During this wave, if a child is seen with any symptoms, they should be immediately sent for an RT-PCR test and an immediate 14-day quarantine. But in the case where children have severe complications and require oxygen therapy, remdesivir or dexamethasone could be used for ages above 12 years. As of now, prevention of the third wave could only be done by increasing the vaccinations. Increased production of Covishield by Serum Institute of India and Covaxin by Bharat Biotech in India, by prioritizing their supply to local needs. Joint efforts could produce 80 to 100 million doses per month. Meanwhile, the government is currently in talks with Pfizer, Moderna, and Johnson & Johnson, who all claim to have vaccines available by October. US President Joe Biden also offered to supply raw materials to India's vaccine producers for producing more vaccines. Although not confirmative, the third wave is very likely to strike.